I'm going to introduce how we choose and apply ice and heat. First of all, I'm going to introduce the effects of ice. The main purposes of ice are to decrease pain and decrease sweating. Since we can decrease pain with ice, we can do more weight-bearing exercises such as walking and squatting. Evidence shows that the use of ice can lead us to have early return to sports. Also, as I said, icing can decrease sweating. It says decreasing secondary hypoxic injury. The areas around the injured ligament may have injury because of the internal bleeding, which causes high pressure around the tissue. So icing is effective to decrease the influence of sweating on the other areas. Also, obviously, we are going to use less pain medication. For your information, 20 minutes of icing can decrease arterial blood flow by 38%, soft tissue blood flow such as muscles by 26%, and bone blood flow by 19%. Next, there are several effects of heat, but I'm going to focus on two main effects, which is to increase tissue metabolism and central effect. As you can imagine, heat can increase tissue blood flow, so you have more blood supply to the injured area. But right after ankle sprain, heat may increase sweating and may also cause more pain. So heat may not be the option for the acute ankle sprain. However, once the pain and sweating go away, heat can facilitate the recovery processes. Heat also has central effect. Central means central nervous system, which is brain. When you have chronic pain, which is longer than 3 months of pain, your sympathetic nervous system might be too activated. In that case, you can calm down the sympathetic nervous system, which is strongly connected to the pain response. It is difficult to tell by yourself, but if physical therapists think that you are too sensitive to pain caused by hyperactive sympathetic nervous system, they might apply heat for your pain. Then going back to the ankle sprain, if you are in acute phase, I would say the first option is icing. Evidence shows that early walking, balance, strength trainings after sprain can lead to decreased pain, range of motion, recovery, decreased risk of re-injury, and early sports participation. Since icing can lead us to move without pain, icing would be a good option right after ankle sprain. Once pain and sweating go away, now you can use either icing or heat. If you still have some pain, you can use ice, but if you have no pain and no sweating, and you are concerned about the tissue recovery, you can use heat. Or if you have chronic pain with sensitive nervous system, you can also use heat. I'm going to introduce how to use ice and heat. There are two methods of icing, continuous and intermittent cryotherapy. I would recommend continuous cryotherapy because, as it says, adequate decreased tissue temperature occurs at around 12 minutes. You can use intermittent cryotherapy, which is 10 minutes of ice, 10 minutes of rest, and 10 minutes of ice if you don't tolerate with more than 15 minutes of ice, because evidence shows it is effective for pain relief. When you use icing, you are going to feel intense cold first, then pain caused by ice, and you're going to feel numbness, which is normal sensation during icing. More than 20 minutes of icing is not beneficial because evidence shows that 20 minutes of ice and 30 minutes of ice show the same effectiveness. When you apply heat, you're going to use steam towel heated by microwave for 10 to 30 seconds. Please make sure you don't get burned yourself. So you can use thick and large towel underneath and over the steam towel. You can apply heat about 15 to 30 minutes. After the use of heat, make sure you wipe the skin and remove the moisture on the skin, because moisture is going to reduce the tissue temperature, which can offset the heat effect. Finally, some people love contrast baths. However, in terms of ankle sprain, it is not as effective as icing. So I'd still recommend icing after sprain. However, contrast bath is effective to remove physical and neurological fatigue. Contrast baths can moderate autonomic nervous system, which is sympathetic and parasympathetic nervous system. If you like contrast baths, go ahead and do it. The tip for this is to start with hot water and finish with hot water. The total time would be 20 to 30 minutes.